My name is Wendy Manell. Greetings from Nashville, Tennessee. We are very happy to have you join us today. Just a few housekeeping items. We will be utilizing the chat and the Q&A for any questions that you have, so please feel free to put those in there, and I will try to monitor that. My name is Wendy Manell, and I am the Director of Marketing with WrightCore. And WrightCore and Aruba, our partner, are very happy to be able and honored to be able to offer this opportunity for you today. We're excited to have our panelists and clients from Tahoe Forest Health System and Monument Health System. And they're going to talk to you today about healthcare at the edge and how they are enabling next generation patient care. So Dylan, if you want to go to the next slide, please. This is our team from WrightCore today, so we're excited to be able to offer this opportunity. And I'm going to go ahead and pass it off to Dylan. Thank you very much.
Thank you, Wendy, and thank you everyone who's able to come. Thank you, Jake and Dr. Lahr, for being able to speak today. My name is Dylan Craig. I'm an account executive here at WrightCore in Nashville, Tennessee, as Wendy said. We are a national value-added reseller with strategic capabilities in networking, security, data center, as well as managed services. And we wanted to take the time today to make sure that we honor some of the recent clients that we've been working with directly in healthcare. And I wanted to quickly highlight some of our recent kind of free marketing here on CRN, some of our Tech Elite 250, 2020, 2019, 2018. So we're consecutively moving up in the reseller world. We're very grateful for our clients across the country. And I'm gonna keep this very short about us, but I'm gonna lean over to Paul Hignut now. Paul, can you hear me?
Yep. Hey.
If you can take it from here and introduce our speakers today so that we can highlight them and a little less on us and make sure that they're able to speak to what they need.
Yeah, absolutely. Thanks everyone for joining. We have with us today a pretty great panel of folks that have been clients of ours for some time and very experienced in their areas. And I will let them sort of give a background and their spot, starting with Dr. Lahr.
Thanks, Paul. So I'm Stephanie Lahr. I am the Chief Information Officer and Chief Medical Information Officer at Monument Health. We are a not-for-profit healthcare system located in Rapid City, South Dakota. We have 5 hospitals in the surrounding areas of Western South Dakota, 25 clinic locations, and became Aruba and WrightCore customers over the last year and a half or so. So excited to share a little bit about that journey. I personally am an internal medicine physician by background, and now sort of sitting in this dual role of CIO and CMIO. So always exciting and fun for me to have these conversations with experts in the area. I learn and lean on our vendor partners a lot when it comes to especially some of the more technical areas, given that is not my background, and we can touch on some of those areas today as well, where we've been able to partner. So happy to be here.
Thank you for joining us. Jake, would you like to give a little bit of background on yourself?
Hi, my name is Jake Dorst. I'm trying to get back to that haircut in the picture. I currently have this going on. So I am the Chief Information Tahoe Forest Health System. We're located in Truckee, California, and we have a smaller sister hospital that we own in Incline Village in Nevada. So we're in 2 states. I've been doing healthcare IT for over 20 years. I've worked with large for-profit systems with community health systems in Nashville. I worked with large not-for-profit systems, Meritus Health in Maryland. Now I'm in a smaller critical access district hospital in California. So I've seen a lot of the various types of hospitals in the country and worked for 3 of the major types, we'll put it that way. And our entire wired, and I guess it's not so recent now, Paul, but we swapped out our wired and wireless infrastructure wholly to Aruba with the implementation services via WrightCore. It was a very good experience for us. So I'm always very obliging when asked to speak on our experience with these two companies. So thanks for having me. It's always a little nerve wracking to be in Dr. Lahr's shadow.
Please.
It's hard to follow. So I'll do my best, but I appreciate you having me and thank you.
Yeah, thanks for joining. And Samuel, would you tell us a little bit about you and your role at Aruba, please?
Yeah, certainly, Paul. And I would like to extend my thanks to WrightCore for inviting me to participate in this as well. Like Jake, I am also a member of the quarantine haircut, no longer looking like our actual photo. That's the reality of life for all of us living in a now hopefully post-pandemic world. But my name is Samuel Hill. I lead healthcare for Aruba Networks. And a long time ago in a galaxy far, far away, I worked as a patient care tech in the emergency room for 7+ years at 2 different health systems. One near where I'm based in Seattle, Washington, and the other based in Southern California, Orange County, actually. So you name it, I've probably seen it on the front lines. I got to live through an electronic health record transition twice at 2 different hospital systems, one of which went much better than the other. And if you would like to know more about that, we can talk later. My role at Aruba is to help translate the Aruba story for the healthcare sector. And the way that I like to do that is through direct engagements with our customers and clients. And so this is a wonderful opportunity to share just whatever brief tidbits of wisdom I have from the Aruba perspective, along with such luminaries as Dr. Lahr and Jake. So thanks for having me.
Yeah, great. Well, with that, we'll just go ahead and launch into the first question for you then, Samuel, since you're right on the roll. And part of that was that, we've been reviewing the latest Gartner report. It showed some pretty impressive wins for Aruba, especially in the critical capabilities area. We've been a partner with Aruba and working with your products for a while. I've seen that kind of you guys leading the way and starting to blaze new paths for years now. Can you maybe talk a little bit about what led you to those wins and where you see it going forward?
Yeah, certainly, Paul. I appreciate the question. Gartner is such a well-respected entity in our world where they, as a third-party evaluator of technology and direction and strategy, they really can be that additional voice that helps to validate what companies are doing. And so we're very proud of the way that Gartner has recommended and said Aruba is a good choice, is the right choice to be making. So in addition to all 6 critical capabilities that we topped the list for Gartner, last year in the critical capabilities, we were 5 out of 6. And then the year before that, we were additionally all 6 out of 6 critical capabilities. And so we're very proud of that. And really the way I look at it is it's just their validation of our strategy. And really long ago, Kirti Melkote founded the company with the idea that mobility and mobile devices was going to be the way of the future, and how right he has proven to be. And so we've kind of maintained this idea of mobility. We want to allow any user and any device to be able to connect anywhere to really any service. And so kind of this malleable, movable platform, if you will, that allows connection to happen across a wide thing. So grateful that Gartner would look and say that Aruba, we're not only in the Magic Quadrant, which we've been there for many, many years on the wireless side, but the Magic Quadrant now we're actually the furthest to the right, and I think we're the furthest up, or we're really close to where Cisco is on the ability to execute access. So we're grateful for their validation of what we've been trying to do for a long time now. And if you think about it, this is really what healthcare has been asking for. Mobility is just another way of saying agility, and healthcare is now increasingly being delivered in a mobile fashion where not only just devices, but the medical IoT devices, and heck, let's get people into their homes to receive care, or if we have to stand up clinics or triage sites or testing locations or vaccination sites, we've got to be agile and we've got to be mobile. So grateful that Gartner would validate the strategy that we've had for many years.
Yeah, that's a great point, and I think that probably rolls well into the question that we had for Dr. Lahr and how she can speak to what it was like working with our teams here at WrightCore and doing the Aruba conversion in your facilities and during the time of COVID.
Yeah, I think, you know, so we decided to kind of embark on this transition. We were end of life in our infrastructure, needed to make a decision for the future. This was about a year and a half ago, started these conversations, feels like a lifetime at this point. And maybe it was actually even a little longer ago than that, but you know, really started to look at the marketplace and see what our options were. Again, we knew we were going to be kind of doing a stem to stern replacement, both on the wired and wireless, and so decided it was our opportunity to really look at the landscape. Jake, being the fabulous colleague and fan of a successful implementation with Aruba and WrightCore, shared some of his experience with me. And again, I'm a customer of Gartner's and did some of that validation. And so we felt like we were on the right track and put together a plan. It's a 3-year plan to go across our entire health system, to replace everything from the wireless and wired perspective, and decided we were going to start with the wireless, and then we were going to go deeper into the core infrastructure, particularly in our larger market in Rapid City. Both of those things were to happen in year 1. We kicked off the projects. You know, our WrightCore team, I still remember them being on site, I think probably in February of last year, and we were trying to start to understand, maybe it was even early March, like right before HIMSS got canceled, what's all this going to be about? What does the future look like? Well, we got to plan a way, we got to get this work done. And the reality was, again, we were end of life, and that started to play itself out further into the year. And so there was no opportunity for us to say, gosh, the timing is a little marginal right now, maybe we'll put this off for a year. We had to keep going, and saw lots of pivots along the way. We started having issues. So over the summer, we were at some of our highest volumes in the hospital ever. We were opening up a new building. We had Aruba infrastructure in that building tied into some of our older infrastructure. We had such high patient volumes, and then we started to see loss of our networking and periodic outages that were then impacting patient care. And as we started to dive into those, the reality was it was our end of life, you know, infrastructure that was just saying, I'm out. And so we had to do a rapid pivot and say, well, we wanted to get wireless. I mean, again, talking about the mobility, we were wanting to roll out things on not only mobile devices in-house, but also for patients with wayfinding and things like that. So cool stuff, but obviously if foundationally we were broken and we couldn't deliver the other care, the wireless stuff was not really gonna get us where we needed to be. So, you know, we had to regroup and brought both the Aruba and WrightCore teams in and said, we have to flip this schedule and we have to do this right now. And again, we have to do this. The plan had been for everybody to be on site, lots of in-person visits to make sure everything went well, all the mapping, all the review, and we just couldn't do that. And so we did it all remotely. And I remember that night that we did our transition, it was in November, or actually, no, I guess it was the first week of December. And you would have never known that there were 60 people across multiple states as we sort of revitalized and did a complete switch of our infrastructure in both all the wired in our primary market, as well as the underlying core to that. All that night, 60 people on a call, some on site, some elsewhere, and just kind of made it happen. And it really, to me, demonstrated that the partnerships we were creating, I already knew the technology was solid. Really, at that point, it was about the partnerships. And I had team members who had periodically, you know, been out with COVID, and we had WrightCore people sort of backfilling them temporarily, and then they had to hand back off. And it was just so seamless. There were times on the call when I would hear a name that I'm thinking, wait, does that person work for me or do they work for WrightCore or Aruba? I can't quite remember, because they were all such a team at that point. It was completely transparent across all three entities.
And you had some other challenges with during this time, when some of the staff were getting COVID and other people as well too, right?
Yeah, I mean, we delayed our go live transition by about a month, with basically, a couple of weeks notice. It was, staffing is an issue, and we had people that were out sick, and we just couldn't move forward. And then, when we did move forward again, December was probably our highest number of inpatients and highest volume related to the COVID situation that we had. And yet operations, just had nothing but great things to say. So happy with how the transition went. I got lots of feedback from executives and others across the health system saying, so that, I mean, what we did last night was kind of a big deal, right? Wasn't it? It just seemed kind of easy. So maybe it wasn't as big a deal as you said it was. I'm like, no, it was a big deal. It was just, it went really, really well, fortunately.
Yeah, I remember that call, and even into the wee hours of the morning, there were still very few barking dogs on a 60-person conference call. It's pretty amazing.
Yeah.
Yeah, well, great, thank you. And so maybe turning to Jake for a minute. Jake, what part of the topic here today is, what does the edge look like in your environment today, and particularly in the COVID era? How has that changed healthcare at the edge for you?
Well, I think it's changed the definition of the edge, right? Like the edge now is somebody's living room. I've got all of my staff working in IT. They're all home. I just got one of those very desks for one of my analysts, because she said, I'm tired of sitting at my kitchen table all day. I want to be able to stand up. So I was like, all right. So I shifted to her. So I guess that's like really I think the edge is being redefined, and then how does that play into the future? You touched on a little bit of it. I don't know. I'm trying to figure out what's the new hype word that's going to come out of this. Whether it's the virtual hospital we keep hearing about. I don't know how real that's going to be. I think there's a lot of. I think it changed some perspectives of how healthcare can be delivered through telemedicine. But I still think that this industry has always been driven by what's reimbursable and what's not. During the pandemic time, though, it was obviously the best way to take care of people and keep your physicians and providers safe as you could by not exposing them to possible COVID. And that was our main concern in a smaller town, is we don't have this huge contingency of backup providers to come take places of our providers if they had gotten sick. So we spent a lot of time and money trying to figure out how we could reduce the odds that our providers would come down with the plague. So with us and WrightCore in particular, with the remote access points that Aruba provides, Paul actually called me and was like, hey, you're probably going to want some of these remote access points from Aruba. They're flying off the shelves. Do you want me to send you some? Which was a first for me, having a vendor call me and say, hey, looking out for us, really, which is not typical. My years with the other major networking provider, that was very untypical. So it was nice. And I said, yeah, send me 100. We ended up getting 50, I think, and we've probably gotten more since. But it enabled me to really send people home almost immediately with their entire setup, their phone, their computer. I'll just grab your computer, here's your wrap, plug this into your network at home, plug this into your computer, and you're good to go. So that was very thoughtful, and I thanked WrightCore for really thinking about us and looking out for us. And like to Stephanie's point, I mean, when we were with Cisco, we were always end of life on something. Like everything, it's made to be end of life. So I think the only thing we have left, Cisco's wise, is our unified communications, which we're working on extricating from the building. So yeah, I think the edge has been redefined as far as where does it end, where does it start, and I think that has some ways to go before that kind of settles down. I think a lot of this again comes down to how relaxed are the HIPAA law is going to stay. I think that was a big eye opener for a lot of people. It's just how limiting HIPAA makes delivering healthcare. It's good. I mean, it keeps people's stuff private, which I think it should be. And, but I think it also I don't say it's an excuse, but a lot of times it's what shuts down a conversation quickly. Oh, well, that's not HIPAA compliant. Well, we can't do anything with that thing. So I think if those are looked at, those laws, and in a meaningful way, I don't think it should go away. I think it should be what parts of this are very effective and what parts of these rules hamper innovation, and maybe have a frank conversation of what needs to stay and what needs to go. That would be helpful to me, I think.
I'm just jumping in on the sort of edge part of the conversation. I think certainly what's going to happen with care delivery remains to be seen. And I think it's more than just about what they're going to allow, but how it's going to be reimbursed. And we're kind of all waiting to see that. But I think what the edge brings us is a lot more than just care delivery, right? I mean, we're not a huge telemedicine area in our region either. We ramped it way up for a while. We by customer and patient demand, really it ramped back down relatively quickly, and that has some things to do with just the kind of population that lives in Western South Dakota and what they want. And I think that's what we're all looking for, right? Is how do we become more customer focused and deliver tools that they want to use, as opposed to us dictating what the tool set can be. And so that comes back to this agility and flexibility. So care delivery is one part of it, but there's all the other elements related to, again, things like, we relatively close to our transition and opening of the new building in the summer. I think it was about 6 weeks ahead of time. I called, both the WrightCore and Aruba team and said, we have a new building. We can't do our traditional grand opening. We can't invite people in. We can't show them around. This is a new space and we want to help people. What could we do for wayfinding, and how could we create a wayfinding application that is patient facing and friendly, and utilizing resources from all three entities? We got that stood up for a new building, leveraging the fact that we had brand new networking infrastructure in that building to begin with, something that as we look at our older buildings, we have to sort of figure out how and when we're going to be able to do that based on the replacement of some of the other infrastructure and the access points and things like that. But again, it was another one of those, that has nothing to do with reimbursement. It really isn't about the care delivery model, but it certainly is about the experience. And then that gets us further into this deep conversation about IoT and all the kinds of devices that we're going to connect to our network. And that number is growing exponentially. And then to tie it into kind of a whole other area, we have the security side, right? So we all want to be able to do all of this stuff on the edge, but not on the edge of security, right? We want it to be extremely safe. And so one of the major benefits and things that we were super excited about and having a lot of conversations about right now is we have, a multitude of outdated operating systems functioning across our organization. IoT and biomed kinds of devices are notorious for being on older and or obsolete or unique operating systems, some of which can't be changed. And so a whole other element that we were very excited about and now are digging further into was some of the functionality that we get with Aruba through ClearPass to be able to look at, well, if I can't change the operating system, I can't update it, I can't tell people, well, sorry, we're not going to be able to use that device anymore. If it's the right device for the right situation, we have to figure out how to make it work. So now at least we have some additional options with segmenting and things like that that are much easier to deal with on a day-to-day basis, as well as give us a lot more visibility to what's out there and what we might need to shift around and segment. And I think that is a really important part of this whole edge discussion, because there's the really great, fun, cool things that come with the edge, and then there's the risky kinds of yucky stuff that sits beneath it.
I would even add too, I think the edge, as you guys have both mentioned, is so uncertain right now. There's a lot of uncertainty around, like you said, how healthcare will be delivered going into the future, the changing of models, delivery, reimbursement, as Jake mentioned. All of this is huge, and there are a lot of conversations there. And I think what we saw in the pandemic was, I think it really revealed what was already there in a lot of health systems. And so we saw just an incredible pivot to digital innovation in a lot of places. I mean, the ramp up of telemedicine, that's no easy feat. I mean, that's a really large project that you have to get adoption across a wide variety of stakeholders and business units and just all sorts of things. But it got done. Getting people to work from home, all these things happened really quickly. So healthcare IT proved, hey, we can innovate. We can keep up with the pace of change. I think the challenge has historically been the risk factor of that, not just the risk and security, but also the risk of downtime. As you mentioned, your system, Dr. Lahr, had that critical outage that impacted patient care. And that is completely unacceptable across a healthcare entity, no matter your size. If you have patients being treated, your network is a foundational transport mechanism for care to be delivered. So we can't allow that to go down. So what happened is a lot of systems started to focus on, we got to take care of what's most important. In a lot of ways, it's this really not very pleasing or, aesthetically good looking. It's not a super crazy application that's going to transform care. We got to make sure the basic plumbing is in line and delivering on the expectations, not only of our IT organization, but of our business, of our stakeholders, and all of the downline end users that are actually consuming that application that rides on the transport mechanism. And so we've seen a lot of this kind of retrenching of, okay, we've got a little bit of time and space. Well, we're not going to be spending crazy money in an uncertain world on new applications or services. Let's make sure our core and our foundational delivery mechanisms are solid.
Yeah, I think that's the key is, and that was one I told people on previous interviews, that we were moving at the speed of administration.
Yeah.
So as quickly as our admin team could come up with ideas, I basically told them, I was like, our wireless infrastructure is strong. We've got a stable, strong, fast system. We can make whatever you need to make, we'll make it work. And part of that was having the, Aruba gear kind of dialed and burned in. We'd had it for a while, but I was confident in that we could do whatever we needed to do as far as connectivity wise. But I was shocked, because I've been doing this for over 20 years, how quickly we moved into telemedicine. Once they said like FaceTime's okay to use and that kind of stuff, like we dialed up Zoom and said we needed 20 user accounts, and we were doing telemedicine within a week of that change, and the docs loved it, for the majority of them, because they know that was the only way that some of these patients were going to be taken care of or have a conversation with their physician. So I think, as far as what the edge is, right, I'm waiting for that. I think that will be defined on what the reimbursement models look like, just like they always are, unfortunately. And I say that, but I cash my checks. So, it is what it is. And I think that there's going to be some change. I am curious to understand, because there was a bit of an exodus of the old guard, I'll say, right prior to the pandemic. I think that during the pandemic, there was also some exodus from the industry, because a lot of times you just kind of fall back into the old ways of doing things. I think that there may be enough fresh blood and new minds in CEO chairs and those types of areas where, the possibility is like, oh, well, we did this during the pandemic. Well, can we keep doing that? That may happen. I think the odds are probably against it, just because change is a 4-letter word in the healthcare world. As long as we don't have to retool a bunch of stuff to get paid, and it's made easy by the insurance companies, it's very possible that the change we've all been asking for 20 years may actually happen. We'll see. Fingers crossed.
But you said how you were able to just respond to whatever your administrative teams wanted. You're just able to say, I've got the confidence that not only your organization, but your technology could handle that. And I think that's got to be the key. Is we don't know what changes are going to happen in the future. We don't know much about the future, but we know what we got right now. And if we can control what we have right now and benefit and improve what we have now, it puts you in that position to say that to your business.
Yeah, and I think that's the other thing is, for us in Tahoe, I just knew we could do it, because we had, and Lord, if we couldn't, after what we'd gone through and the money we spent, I'd be working at Barton or somewhere else. So I think it's the confidence and kind of what you had said about having that strong foundation of your infrastructure. That really gives you the freedom to think outside, like, okay, now I have these new tools. There's always 4 or 5 ways to skin a cat, and it's nice to have the ability and tools to do it. I'm going to change my background because Dr. Lahr wanted to make sure I changed it a couple times.
Well, we're just also envious of the beautiful place you live. We may as well get to see a little glimpses of it.
That's on a different continent. But
yeah, if anybody, that one is okay.
Yeah.
Keep it local. Keep it local.
Oh.
Yeah, if anybody needs to go do a site visit for an Aruba network, go see Jake. Any time of the year, it's beautiful.
It's true. I'm lucky. I'm location lucky.
One thing I was going to mention, based the comment about sort of how this is not really, you didn't use the term, Samuel, but it's not the sexy sort of put it out in front of people. Hey, look what I want to spend several $1 million on over the course of the next several years. Don't you want to do this too? But I think that our healthcare administrators and our boards are really becoming more in tune with what it takes to deliver healthcare leveraging technology. And those were some really important conversations that, again, I leveraged resources, time, and even slide content, from both Aruba and WrightCore to sort of help me tell the story, so that when I did go to the board and something that no one ever physically sees but is sitting beneath everything, meant something and felt like something to them and seemed tangible, because again, it was, are we going to spend money on that? Or, something else that might be like, we need to buy 300 new beds, right? Everybody can see the bed that the patient is laying in and determine we need new ones or we don't. And so, that took a bit of artwork in sort of figuring out how to make something that's non-tangible, something that felt real, and a level of urgency, et cetera. I mean, we were really lucky that we were already as far into the conversation as we were when we started seeing these critical outages. because we were able to basically make a relatively rapid transition, flip-flopping a couple of things and get right back on our way. I can't imagine how those conversations would have gone had we not already been sort of as far down the road as we were, and already had the endorsement and the understanding of the leadership team and the board of what it meant to do this and why we were doing it, and that the cool stuff on the edge and things like that we're still trying to define won't happen without this other, more foundational pieces in place.
So, I mean, help me understand that a little bit as you prepared for those conversations with your peers and to the board. And I mean, because you're right, if you're walking your CEO or your CFO into a data closet, you're probably not going to help them see the vision of it. So that long story, so you had to go and craft the story. What were some of the things that you used? What resonated with your board as you generated their support?
Yeah, I think, again, we were talking about, for example, the wireless capabilities, mobility across our buildings between them and out to patients. And so translating, some of the things that our board and our leadership team were used to seeing even in other industries, and that experience that they're having, I could take that and sort of say, when you go here and you see this happening, this is kind of what's sitting behind it. And as of right now, when you tell me you want to start doing this in our locations, what I tell you is we can't. We don't foundationally have the infrastructure to do that. And we need to make a transition to something that is more future-proof than where we are now. Not that anything is truly future-proof at this point, but it's really about, the opportunity to take something that is built on a flexible foundational structure, that where the ideologies are not so rigid that we can't look to the future and say, oh, again, this is a turn in the path, as opposed to sort of some of this old rubric, which is just how we do it. And that's not going to take us into the future. So it was a combination kind of all those things.
And I think I've heard you say this before. You also, like Jake did, you transformed your IT organization into a department that could say yes to your business instead of having to sit there and say, no, we can't, we're not ready for that.
Yeah.
I think that's a really good point, and that's what Jake was saying earlier about moving at the speed of administration. Jake, maybe you could talk a little bit about our initial working with Tahoe Forest being far pre-COVID and in a different environment entirely. What were the sort of things that we were able to do to kind of help you guys see the switch to Aruba and looking at it in a longer term time frame of, well, we need to replace this right now?
Yeah, I think for us, and for me, most of the time, it comes down to money. And we were able to really look at an ROI with WrightCore that blew Cisco out of the water. A big part of it was the ROI. I was very grateful for the Gartner Magic Quadrant because I could show my board anyway, that there had been some research done, and actually that year that I was pitching this, Aruba had beaten Cisco in all 6 networking categories in the Magic Quadrant. So it was very powerful to be able to say, like, not only is this going to save us close to $1 million, it's also better. It has to be as good or better if it's going to save us money, and it has to work, right? Technology overall has to work. So, after the presentation, they're like, oh, well, this sounds like a good idea. Let's go do. And we went and did it. So I think that ROI is very important. And WrightCore was very good. Like, they came on site. I wanted just to get an assessment because I had known for a while that we had challenges with how our network was set up. So I wanted to get a third party kind of look to it, which WrightCore was able to provide us at the time for no charge. I don't know if that special's still on the table.
It sounds like it is now, Jake.
Yeah, all right on.
Yeah, I guess so.
Yeah. So we got a
Yeah.
really good, assessment of our current environment, and then had them engineer and spec out what it would look like in an Aruba world. For us, we live 90 minutes away from HPE's campus down in Sacramento, and we were able to go visit there and actually see they weren't fly by night. They've got one of those 0 decibel rooms that freak you out down there, which was cool. And then we had a bunch of sushi. So to me, it was a really good partnership. I felt like I had no longer had a partnership with our previous vendor. It was just to basically call me up every year, year and a half, and make a deposit. Where's my check, kind of thing. But really no personal relationship. How's things going? Is there anything we can do to make it better? Like Cisco would have never called us if they had wraps flying out the door.
Yeah. Well, thanks. And Stephanie, I would point this at you too, is part of what we do at WrightCore is we've been working in healthcare. The team that we have today has been working in healthcare for 20 plus years. We're not the super mega VAR that slings all the different kinds of boxes. We do try to make a meaningful difference, so understand the business of healthcare as well, and establishing those partnerships. And so maybe you would be able to share with the attendees a little bit about your experience with us at the onset prior to COVID again as well, and what was the differences that made you feel comfortable with going with WrightCore?
Yeah, well, obviously Jake's endorsement, right, was huge. Although I didn't ever get to go and visit. I don't know how I missed out on that opportunity. I should have done that. But I mean, I think you actually just sort of already hit on it. And that was I definitely have some strong relationships with, I think when you're our size, and Jake probably feels the same way being smaller than we are, VAR relationships are really important to an organization my size, because whether we're talking about network infrastructure or data center infrastructure or whatever it might be, I'm usually not going to be in a position of being big enough that I'm going to have those direct conversations with whomever that is, right? It could be Citrix, it could be VMware, it could be Cisco, it could be Aruba. If they're the big players in the market, usually there's some layer that sits between us at my size. And to be honest, that's almost a value to me, because that's how I can carry something forward, is by having a partner who can represent me as well as other like-minded and similar sized customers, and then utilizing their buying power or relationships with those vendors, carry that more upstream. And so I have a number of what I would say, not a number, actually a very small number of really close vendor sort of VAR kinds of relationships. And when we went to do this assessment, I think what we really, really wanted to hone in on was the expertise and the focus, right? I mean, I think I have, even on the application side, most of the companies that are serving a whole bunch of different areas, a lot of the people that work for you, whether this is in consultative, arenas or in the more technical support arenas, you oftentimes are sharing resources, right? Like you say, I know I can present this, I know I can solve this problem for you. You don't know whose name is on the page at the moment. Once I say, yes, I want you to solve that problem for me, then a lot of these other companies are going out and now looking for that person and hoping that they're going to find them. But it's not like, hey, John's worked for us for 15 years. He's done this many hospitals. He's done this and this. And so, there's a balance there in having a partner who and trust, but that really they're so big that not everybody who's with them is with them all the time, right? They have pieces of those people. And then with some of the smaller players or more focused players, when it is your wheelhouse of expertise, you get that depth and that bench was written at the day we had the conversation. And so for me, that's probably what I think was that final decider for us in deciding that WrightCore was going to be our partner versus utilizing one of the VAR situations that we already did have really good relationships. Was I knew who the bench was. You could show me the list. Here's the people. You want to talk to them? Let's get them on the phone. This is going to be who's on site at your location. Of course, this was pre-COVID when we thought everybody was going to be on site, but that list didn't change. And knowing that this was a primary area of focus for you and that the bench was set gave me the added confidence that my very small networking team, who was going to be taking on this massive undertaking, was going to have really close partnerships. And again, it was going to feel almost seamless to the point I can't remember, like, does he work for me or WrightCore? I can't really remember because I talked to each of them in the same way and the same amount of time.
Yeah, I think
Yeah,
that's a good
great.
point. And that I need to disclaimer that I've known Paul. I worked with Paul at Community Health Systems over 20 years ago. So I've known him a very long time. And I think what Dr. Lahr was saying is that trust. Like, I knew Paul's not going to rip me off as bad as another VAR. And he wasn't going to come over engineer and oversell me, which had been happening for a while with the other vendor. And with no follow-up. So I knew at least I was going to get an honest opinion of my network. Paul would rather be right than say the wrong stuff to make more money. And I know that about him. But I don't know that about, I mean, the VA is value add in VAR. And if they're not adding a value, but you've got to double check their numbers with 3 different vendors, which we do anyway, just because we're a district hospital of California. You know, I check WrightCore's numbers too, and they're usually the right number. It's just trust, really. I think that Dr. Lahr hit it on the head. Is, do I trust them? I know they've got a deep bench. I trust Paul's going to do the right thing because he wants to do a good job above all else. Because everything in this industry is based on reputation, really. And if you're known for being an honest vendor that can get stuff done, you'll do well. I mean, even if you're a dishonest vendor that does half-ass jobs, some of those guys do well.
I do enjoy being right. You're correct about that.
I know.
Well, and wrapping up, one more question for Dr. Lahr. You know, Jake talked a little bit about the ROI stuff that we did for him and how that was able to help him explain the value proposition for Aruba in a different light than the technology piece of it as well. When you're talking to board members and folks that are making those financial decisions, aren't always up on all the technology. What was that experience like for you, and did you find that as helpful too?
It was absolutely helpful, right? I mean, I think we created a comparison slide for the, you know, kind of incumbent predecessor and what we estimated that would be versus the transition. And we talked about those things, right? I think really early, as soon as I had sort of established that this technology could definitely take us where we wanted to go, it wasn't that I wasn't willing to go to the board with a higher price tag if I needed to, if it was the right solution for the organization for a long-term relationship. That, you know, I was willing to do that if that was necessary. The great news was we were able to, in my opinion, move to a better product and do it for less than it was going to cost us to basically do a refresh of what we already had in place. And we were going to get added functionality that we weren't even really seeing be possible in the other, with our other opportunity. And so certainly being able to translate that into, you know, a relatively simple, straightforward copy out of, you know, clip out of an Excel spreadsheet showing a handful of numbers that get added up to one number that's smaller than one on another page, you know, on the other end of the Excel spreadsheet, that's as complicated as we really wanted to make it at that level, because again, I mean, the board was interested in the ROI. We were making an investment, and maybe that investment was going to be more, maybe that was going to be less. It was part of telling the story. You know, the silver lining was I could also say, gosh, it'll be less than the replacement, which almost was unbelievable to them, but was happily true.
That's great. Thank you. That's what I had for today. Wendy, do we have any extra questions or open it up for the chat?
I've got
I've
got some chat questions.
Yeah, go ahead, Dylan.
That came in. Let's see, one second. This one says, I think it's just to the panel. What's your biggest concern when leaving? It looks like both of you had said Cisco, who have known and trusted. So the biggest thing is, what's the biggest concern, I guess, leaving something you've been using for such a long time and transitioning to Aruba?
I don't know that I really had any concerns. There were definitely a lot of details to work through, and we're still working through. Probably my biggest stress right now is that we live in a hybrid environment. Because again, I'm way too big to do all of this. I mean, we're not huge, but we're way too big to do all of this at one time. And so, that's, I mean, that's probably the sort of ongoing challenge that we're working through, is knowing that we're living in a bit of a hybrid environment over the course of 3 years while we work our way through the entire, you know, health system ecosystem to do this. But it wasn't really, it's not a worry, it's just sort of a reality and something that we have to keep in mind.
I think mine, it was really more based around feelings than anything else. Like technically, we all knew that it would work, right? It's all based on open standards, networking standards. It was just the fear, addressing the fear and the worry of my staff having to move, you know, off of something that they are good at, Cisco command line, and getting into a new platform that they were expected to maintain and have uptime and all that. So it was really kind of addressing, am I going to get the right training, and or can we go, what's the speed at which we're going to swap this out, and really ease into the new environment. You know, the concerns that my staff had and transferred to me were, at the time, Aruba, the Cisco TAC was basically on speed dial for all my networking guys, and they spent their days with TAC for a long time. That was, Aruba's TAC is good and has gotten much better from where we started, but at first it wasn't the immediate call back and fix kind of thing that Cisco was, that my staff was used to with Cisco. You know, knowing everybody's
interestingly, I would say we had almost the opposite experience, yeah. Right? I feel like we were at a point with our staff where they were ready to jump. I mean, I think to an extent, my team is used to me saying, I don't want to keep doing things the way we've done them before, just for the sake of doing them. And we should probably change things up just to keep everybody fresh. So me coming in and saying, hey, I think we're going to do something different. I think they were like, oh, shocker. And so, and most of those instances have turned out well. And I think that's now kind of part of our fabric. So I think actually most of my team was excited, and we didn't necessarily have the same level of responsiveness all the time. And we did feel like we were left hanging. And we also sort of felt like there was a tool set, some of the tool set that we were missing, that we just hadn't found the right tools from them to be able to manage some of the things we needed to manage. So, you know, I think it kind of depends where your team is at, and there's our differences in time, and things are moving so quickly that, I mean, Jake, for you, this was what, three and a half years ago, somewhere along there, and just how much has changed in that period of time. My team was ready to roll. Yeah, with the old and in with the new.
Well, they would come and complain to me about Cisco, and then when I told them, I was like, it's okay, we're going to move away. No. Change, no change. but yeah, it's like we would find bugs and have to, my guys would have to wait till certain hours to talk to the Cisco development team in India at very off hours. And I'm like, it's not our job to find bugs for Cisco. It's not like a feather in our cap. Like that's wasting a lot of your time, and our time. Like I don't want you guys to want to do that. Let's get something that just works, and you can stop having WebExes 3-4 hours a day, which they have, and I think that I haven't heard any complaints, but my IT directors told me that the responsive level and time to fix has gotten a lot better, according to my staff. So that's good. I think, and that's something like you never see big companies like this change as fast as I've seen HP Aruba change or improve, I should say.
I've always maintained that it's hard to argue with works.
Right, it just works.
Yeah. Well, we're coming up on the hour. I think Dylan had a little bit to close it out, and thank you guys for being a part of this. It was really fun.
I didn't have much more to say. I just appreciate your honesty. I mean, I think the real value here, Jake, as you say, in the VA and the value add is your experience, your direct experience in utilizing this solution and partnering with Aruba and, of course, WrightCore. But I think it speaks volumes to your honesty that you're putting out into the network of the healthcare market.
Thank you.
It's very valuable to your peers, and I just want to say a big thank you to you all for doing this. We appreciate it. I'm sure your peers do.
I appreciate you.
Thank you.
Me too. Excited to be
Appreciate
able
you
to
having me. And it's an honor to be on the same panel with Dr. Lahr.
I'll echo that. I'll echo that.
Oh, please.
I'm surprised you
You're
had
ridiculous.
time.
Whatever.
You're a busy woman. I know that.
Yeah. These are some of my favorite things to do though, right? I mean, we're all going through challenges and trying to figure out the next best step. And again, as a physician by background, this is not stuff that I know off the top of my head or comes to me inherently. I lean on people like Jake or Paul or, the whole team all the time. And so I feel like I sort of owe it to people to bring my experience and share that back, because I have been able to leverage and utilize the expertise and knowledge that goes beyond what I have in so many other areas. So these are always some of the most fun for me to be able to come and share that.
Thank you.
Well, it's good too for us in smaller organizations to be able to have a voice like this, because it helps when I negotiate with other vendors. Mm-hmm. In fact, when we moved away from the whipped tail, we were going to be stuck with the cost of that, and because I was doing much more pre-COVID, speaking at certain events and things like that. I basically told them, was like, I go to 3 or 4 major conferences a year. I speak with a lot of people. I know Dr. Lahr. And they're like, I said, I don't want to have to talk bad about your product. And they're like, we'll take it back. Just send it to us. We'll give you a credit. So it helps.
Stephanie discount.
It's all about collaboration.
Yeah.
Yes.
Well, and if you're not spending the money with an organization, you may not have a big voice with that organization because you're smaller. But I think if you have a bigger outside voice in the industry, it can help with a little bit of leverage. Mm-hmm. And now that I've actually pulled the trigger and removed Cisco and put Aruba in, now they know I'm crazy enough to follow through with my threats.
Well, it's good insights, I think, for everybody on both sides. Like you said, Jake, small, and then Dr. Lahr, bigger. I mean, meeting in the middle, I think, is what keeps healthcare moving in this country, and you all collaborating, regardless of size, is what's going to keep our care-based system in America moving forward. So I just appreciate you guys making the time today. I think without that, Wendy, if you have any other follow-ups, I think that'll do it for the call.
No, I think that's it for today. And we are recording this, so we will follow up with a recording link once that's generated. And feel free to reach out to myself or Dylan or Megan Rose-Byers if you would like to speak with us further about how we can help you. And again, we just appreciate the opportunity to spend this time with you today. And thank you so much to our panelists. Have a great day.
Thanks, everybody.
Have a good one.
Bye.